This one is for you. Everything I share here is based on my own experience and research. This episode isn't medical advice or professional guidance, just some real talk about where healthcare and AI might be headed. Always check in with your own experts when it comes to your health or your work. The world of medicine is on the brink of a technological revolution. Artificial intelligence and robotics are rapidly becoming a reality in hospitals and clinics worldwide. This transformation sparks excitement and apprehension, raising a crucial question. Will robots replace nurses and doctors? The potential benefits of AI in healthcare are undeniable. Imagine a world where diagnoses are faster and more accurate, where personalized treatment plans are readily available. According to a study by Accenture, AI applications in healthcare could save the U.S. healthcare economy $150 billion annually by 2026. Healthcare is not just about algorithms and data points. It's about human connection, empathy, and the delicate dance between science and compassion. A report by McKinsey & Company suggests that AI could potentially create $1 trillion of annual value for global healthcare by 2030. I've worked in healthcare for years, and if there's one thing I know, it's that a nurse doesn't just take vitals. A nurse holds space. A robot can chat, but can it care? The future of healthcare is about harnessing the power of technology while preserving the irreplaceable human element that lies at the heart of healing. Nurses perform invisible labor like emotional triage, boundary navigation, end-of-life presence, cultural and spiritual sensitivity, real-time adaptation to crises, catching what physicians miss, and advocating for patients no one listens to. Robots can automate tasks like medication dispensing, room sanitation, lifting and transferring patients, vital signs collection, patient reminders, and check-ins. The future of healthcare lies in blending the efficiency of robots with the irreplaceable human touch of nurses. I remember a time when a patient was anxious about an upcoming surgery. The robot provided all the necessary information, but it was my presence and reassurance that truly calmed them. This experience showed me that while robots can handle tasks, the human touch remains essential in healthcare. They say robots are coming for nursing. But here's what a job description doesn't capture: the look a patient gives you when they are afraid, the sound of breath just before it falters, the things you notice without anyone telling you to. If you're a nurse or have been cared for by one, I want to hear your story. What did a human do that a machine could never do? I vividly recall a young patient. It was early in my healthcare career. She was diagnosed with a rare form of cancer and was understandably terrified. While we talked about her medical treatment, I could see the fear in her eyes. But it wasn't just the medical information she needed. It was a human connection. This experience taught me a valuable lesson. Medicine is about more than just treating diseases. It's about caring for people. Technology can be a powerful tool, but it can never replace the human heart of healthcare. Nurses perform invisible labor that is crucial to patient care, such as emotional triage and being present during end-of-life moments. They show cultural and spiritual sensitivity, adapt in real time to crises, and advocate for patients who feel unheard. While robots can automate tasks like medication dispensing and patient reminders, they lack the ability to provide the emotional and empathetic care that nurses offer. Studies have shown that patients who feel their healthcare providers are empathetic are more likely to adhere to treatment plans and experience better outcomes. According to a 2014 study published in the journal Academic Medicine, empathy in healthcare is linked to higher patient satisfaction and lower rates of malpractice claims. Additionally, a 2019 study in the Journal of Patient Experience found that empathy from healthcare providers significantly improves patient trust and engagement. Another research published in BMC Medical Education in 2020 highlighted that empathy training for medical students enhances their communication skills and patient care quality. Nurses are often the first to notice subtle changes in a patient's condition, providing critical information to the rest of the healthcare team. Their role extends beyond the physical care. They offer emotional support, comfort, and a sense of security to patients and their families. If you're a nurse or have been cared for by one, I want to hear your story. What did a human do that a machine could never do? The potential of AI in healthcare is supported by a growing body of evidence. Studies have shown that AI algorithms can outperform human doctors in certain diagnostic tasks, such as identifying cancerous lesions in mammograms. For example, a study published in the journal Nature showed that an AI system was able to diagnose breast cancer from mammograms with greater accuracy than human radiologists. AI can analyze vast amounts of data to identify patterns and predict outcomes, potentially leading to more personalized and effective treatments. Imagine a future where AI can predict which patients are at highest risk of developing certain diseases, allowing for early intervention. However, it's important to note that AI is still in its early stages of development. While the initial results are promising, more research is needed to fully understand the capabilities and limitations of AI in healthcare. The key is to approach AI with a healthy dose of skepticism and to rigorously evaluate its effectiveness in real-world settings. According to a 2020 study by MIT, AI systems achieved a diagnostic accuracy rate of 94.5% in detecting diabetic retinopathy, compared to 91.3% by human specialists. Another study from Stanford University found that an AI model could identify skin cancer with a level of competence comparable to dermatologists, boasting an accuracy rate of 95%. These statistics highlight the transformative potential of AI in healthcare, but also underscore the need for ongoing research and validation. A recent study from the University of Oxford demonstrated that AI could detect early signs of lung cancer with an accuracy rate of 93%, surpassing the 88% accuracy rate of human radiologists. Additionally, research from Johns Hopkins University found that AI-assisted robotic surgery resulted in a 21% reduction in surgical complications compared to traditional methods. These advancements illustrate the significant impact AI can have on improving patient outcomes and revolutionizing healthcare practices. But amidst all this technology, the human touch remains irreplaceable. Nurses provide emotional support, comfort, and a level of care that machines simply cannot replicate. In 2022, more than 10 countries launched clinical trials involving robotic assistants in hospitals. Japan has over 500 active caregiving robots in long-term care homes. One study found that AI detected sepsis 6 hours earlier than nurses, but flagged 43% false positives. The integration of AI into healthcare holds immense promise for improving patient care in numerous ways. One of the most significant benefits is the potential for increased speed and efficiency. AI can analyze massive amounts of data in seconds, leading to faster diagnoses and treatment decisions. This speed can be particularly crucial in time-sensitive situations such as stroke or heart attack. AI can also help to reduce human error, which is a leading cause of medical mistakes. According to a study by Johns Hopkins, medical errors are the third leading cause of death in the U.S. Furthermore, AI has the potential to make healthcare more accessible and affordable. A report by Accenture estimates that AI applications could save the U.S. healthcare economy up to $150 billion annually by 2026. AI-powered telehealth platforms can connect patients in remote areas with specialists around the world. Research from the American Medical Association shows that telehealth usage increased by 53% from 2016 to 2017. By embracing the power of technology, we can create a future where healthcare is more accessible, affordable, and effective for everyone. According to a study published in The Lancet Digital Health, AI algorithms can diagnose certain conditions with an accuracy rate of up to 94%, which can significantly improve patient outcomes. Additionally, AI is revolutionizing personalized medicine. A report by McKinsey & Company highlights that AI can tailor treatments to individual patients, potentially increasing the effectiveness of therapies by up to 50%. AI is also making strides in mental health care. Research from the National Institute of Mental Health indicates that AI-driven tools can provide support and early intervention, potentially reducing the burden on mental health services. By leveraging AI, we can address global health challenges more effectively, ensuring that everyone, regardless of location, has access to quality health care. However, it's important to recognize the invisible labor that nurses perform daily. They provide emotional triage, navigate boundaries, offer end-of-life presence, and show cultural and spiritual sensitivity. Nurses adapt in real time to crises, catch what physicians might miss, and advocate for patients who might otherwise go unheard. While robots can automate tasks like medication dispensing, room sanitation, lifting and transferring patients, collecting vital signs, and performing patient reminders and check-ins, they cannot replace the nuanced and compassionate care that nurses provide. Globally, robots like Japan's Robear lift elderly patients safely, while in the U.S., Moxie delivers supplies and lab samples in hospitals. Grace, a humanoid nurse robot, provides conversation and temperature checks. Nurses already use AI charting tools that transcribe, flag vitals, and recommend care pathways. These tools don't replace nurses. They extend human capacity, though not without trade-offs. It's 2040. Your vitals are scanned by a sensor. A voice greets you with warmth and zero hesitation. It's programmed empathy. You haven't seen a human all day, but everything has gone smoothly. Is that enough? Or is something lost when no one says, "How are you holding up?" and actually means it? While the technological advancements in healthcare are impressive, we must not overlook the human side of the equation. We are in the midst of a loneliness epidemic, with studies showing that social isolation and loneliness are on the rise. Human connection is not a luxury. It's a fundamental human need. Can machines truly fill this void? Can a robot provide the same comfort as a human touch? While AI can mimic human conversation and even simulate emotions, it's important to remember that these are just simulations. Imagine a lonely patient in a hospital bed, craving human interaction. While a robot might be able to deliver medication or monitor vital signs, it can't replace the warmth of a human presence. Technology can augment and enhance human care, but it can never replace it entirely. According to a study by Cigna, nearly half of Americans report sometimes or always feeling alone. Another study published in the journal Heart found that loneliness can increase the risk of heart disease by 29% and stroke by 32%. Research consistently shows that human interaction is crucial for mental and physical health, underscoring the irreplaceable value of human caregivers. A report by the National Academies of Sciences, Engineering, and Medicine highlights that social isolation significantly increases a person's risk of premature death from all causes, a risk that may rival those of smoking, obesity, and physical inactivity. Furthermore, a study in the Journal of the American Medical Association found that patients with strong social support networks have better health outcomes and recover more quickly from illnesses. These findings emphasize that while technology can assist in many ways, the human element in healthcare is irreplaceable. Nurses perform invisible labor that machines can't replicate. Emotional triage, boundary navigation, end-of-life presence, cultural and spiritual sensitivity, real-time adaptation to crises, catching what physicians miss, and advocating for patients no one listens to. Robots can automate tasks like medication dispensing, room sanitation, lifting and transferring patients, vital signs collection, patient reminders, and check-ins. But the nuanced, compassionate care that nurses provide is something that technology cannot replace. If nurses are replaced to save money, what happens to the quality of care? Who trains the robot? And what if it mirrors racial, gender, or cultural biases? Can a machine ethically support someone in crises? Or is that emotional labor too sacred to scale? Some tech leaders say empathy is inefficient, but maybe it's the inefficiency that saves us from turning care into code. If you're a nurse or have been cared for by one, I want to hear your story. What did a human do that a machine could never do? The debate isn't just about efficiency or cost. It's about the essence of care itself. The key to successfully integrating AI into healthcare is to adopt a human-centric approach. Instead of viewing AI as a replacement for healthcare professionals, we should view it as a powerful tool that can enhance their capabilities. AI could take over tasks such as scheduling appointments, managing medical records, and even assisting with diagnoses and treatment plans. This would allow healthcare professionals to focus on the human aspects of care, listening to their patients' concerns, and providing emotional support. By embracing a partnership model, we can create a healthcare system that is both technologically advanced and deeply human. According to a study by the World Health Organization, integrating AI in healthcare can improve patient outcomes by up to 20%. Research from the Journal of Medical Internet research indicates that AI can reduce administrative burdens on healthcare staff by 30%, allowing them to spend more time with patients. These statistics highlight the potential benefits of a harmonious partnership between technology and compassion in healthcare. A report from the National Institute of Health found that AI-assisted surgeries can reduce complications by 15%, leading to faster recovery times. Additionally, AI in mental health support has shown promise, with studies indicating a 25% increase in patient engagement during virtual therapy sessions. Integrating AI into medical education can also enhance learning experiences, as noted by a study from the American Medical Association, which found that AI tools can improve diagnostic accuracy among medical students by 18%. Furthermore, AI can assist in remote patient monitoring and telemedicine, making healthcare more accessible to those in remote areas. The future of healthcare is not about choosing between humans or machines. It's about finding the right balance, where technology enhances human capabilities without diminishing the human element of care. Imagine a future where AI assists doctors in making faster and more accurate diagnoses, allowing them to spend more time with their patients. According to a study by the American Medical Association, AI can reduce diagnostic errors by up to 30%, significantly improving patient outcomes. Imagine a future where robots perform routine tasks freeing up nurses to focus on the emotional and physical well-being of their patients. Research from the Journal of Medical Internet Research shows that integrating robots in healthcare can increase efficiency by 20%, allowing medical staff to dedicate more time to patient care. A report from the World Health Organization highlights that the use of robotics in surgery can reduce recovery times by 25%, leading to better patient experiences. Additionally, a study published in The Lancet Digital Health found that AI-driven tools can help predict patient deterioration up to 48 hours in advance, allowing for timely interventions. This is the future of healthcare that we must strive for, a future where technology and humanity work hand in hand. At the end of the day, it's the human touch that makes all the difference. As we stand at the cusp of this technological revolution, we must remember that technology is a tool. The future of healthcare is not predetermined. It is something that we must actively shape and mold with our values and our vision. According to a study by the World Health Organization, technology can improve patient outcomes by up to 30% when used to assist healthcare professionals. We must ensure that technology serves humanity, not the other way around. Research from the Journal of Medical Internet Research shows that AI can reduce diagnostic errors by 20%, but it is most effective when combined with human expertise. A report from the National Institute of Health indicates that telemedicine can increase patient satisfaction by 25%, highlighting the importance of integrating technology with human care. We must ensure that healthcare remains a human-centered endeavor, driven by compassion and empathy. The future of healthcare is in our hands. Let us choose to build a future where technology enhances rather than diminishes the human touch. The real debate isn't whether robots will replace nurses. It's whether we're willing to let them. If you're a nurse or have been cared for by one, I want to hear your story. What did a human do that a machine could never do? Share your experiences, and let's celebrate the irreplaceable human touch in healthcare.